Good evening to you. There's a warning of a potential rise in cases of undiagnosed mouth cancer. It's after data obtained by Points West showed some NHS dentists here haven't provided routine checkups during the pandemic. As our health correspondent Matthew Hill reports, many practices are trying to increase the number of patients they see.
This dentist in Hanham is now trying to catch up with a backlog of routine checkups. That's because during the first 11 weeks of lockdown, it had to cancel 3,000 examinations.
We are generally seeing people with higher needs, so higher risk of decay, higher risk of gum disease problems. That said, we are trying not to cancel any patient. Generally, people who were seen early in sort of January, February of this year, we've let their recall go a bit further and seen the people that were due early on in COVID.
Checks are a crucial way of preventing disease, not only gum disease, but even cancer. But according to our research, many dentists are simply not doing this. We phoned 40 NHS dental practices across the West to find out how many were also offering routine checkups. In Wiltshire, 3 out of 10 were not offering them. In Somerset and Gloucestershire, it was 5 out of 10. And in Bristol, 6 out of 10 that we phoned were not offering routine checkups. According to the Oral Health Foundation, that will put patients at increased risk of undetected mouth cancer.
People could potentially be missing out on the chance for an early oral cancer diagnosis. So we would be encouraging anybody who's got any of the potential signs and symptoms of mouth cancer. So this is an ulcer that doesn't heal over a period of about 3 weeks, any unusual red or white patches, any lumps in the head and neck area. That really is a reason for getting along to your dentist. It's not a routine checkup. It's to make sure that you haven't got something that's potentially much more serious.
Hanham Dental Practice is one of a minority of NHS dentists capable of doing aerosol generating procedures like this. That's because they have the right airflow combined with PPE to do this with a minimal risk of spreading COVID-19. I understand NHS England is trying to set dentists a new target to achieve 45% of their pre-COVID activity. Now that sounds a low bar, but many will struggle to meet that target.